Well, hi, everyone. I'm Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. We're back with a guest we've had on many times. That is Claude Royster, Vice President and General Manager of Health and Wellness at CareCredit and Synchrony. Claude, first of all, I just want to welcome you back to the show. How are things going with you?
Things are going very well. It's been a busy start to the year. Everything's just moving very fast, but pleasure to see you and pleasure to be here.
Yeah, we were talking offline. We talked previously when you were on the show. You are a true road warrior, but you said that had dialed back just a little bit, but it's about to ramp up again. I believe you were sharing that you're going to be in Minneapolis at MGMA's private practice conference in June. Is that correct?
That is correct. And a little bit about my background. I actually lived in Minnesota for about 12 years, working for a prior organization. But it's been a while since I've been up there, so I'm looking forward to spending time at the conference, but also going back to a place that at one point I called home.
Okay. Now, you have been on the show before, but it's always good. We never know if we'll get new listeners that may not have heard before. So just tell us, if you don't mind, just a little bit about your background and then what you're doing there at CareCredit and Synchrony right now.
Absolutely. So for the audience, again, my name is Claude Royster. I have been in the consumer finance industry now for about 35 years in a variety of different leadership roles, sales operations, merchant experience, et cetera. I'm currently with CareCredit and Synchrony right now. I've been in this part of the business for about 5 years. And my responsibility is basically I provide oversight of over 40 different industries in the healthcare space. And my goal is to work with providers, multi-specialty physician groups, and come up with innovative solutions that are going to help them in their practices and their facilities to help patients get the care they need when they need it.
Perfect. Yeah. And our main theme today is navigating healthcare cost, evaluating those in-house financing plans and third-party partners. And so that really sets the stage for where we are with our discussion. So with that said, what are the trends you're seeing right now around rising cost and how they're impacting patients?
Absolutely. So we just talked a little bit about some of the macro effects, but if you drill a little bit further and understand what's happening with the patients, there's some interesting statistics. We periodically go out and do some surveys and research, and I'll just share some of the comments that we have found, some of the research we found. 1 out of every 2 consumers report that they have delayed care that they need due to cost. Over 50% said that they struggle with paying for their costs because of some of the out-of-pocket medical expenses, deductibles, things like that. And 3 out of 4 said that they would pursue additional medical services if they had the means to pay for them. So when you bottle that up, and you think about some of the sentiments from consumers. Financial discussions play a large part in when they get care, perhaps where they get care, and the timing of all that. So again, my responsibility is to work with the providers to ensure that they are taking time to have those discussions, educate the patients, whether it's, you're in network, out of network, what does that mean to you financially? And here are ways that you can get this care by thinking about the financial and taking that off of their plate and focusing more on the care that they need.
Yeah. What are you hearing then from providers about what they're seeing, specifically when it comes to barriers around care financing? What's going on in that space?
It's really just it's education and ensuring that they understand the options that they have. There are, and as the industry evolves, we're trying to digitize how we do business with providers to make it seamless, make it frictionless, make sure they understand how it benefits them from a practice perspective. And so it's really important for us to not only focus on the patient, but also the provider, and how we can help them alleviate some of the administrative costs associated with providing care to patients. And many of them have taken on the responsibility of doing in-house financing or in-house billing. We're a bank, and we lend money and we collect money, non-recourse. We would like to be that partner with the providers to ensure that they can focus on delivering care. They can focus on making sure that that patient is comfortable and getting the care that they need, while we focus on the administration financially to ensure that those customers have the ability to meet those financial needs related to the care that they receive. And that frees up, receivables and things like that for the providers, so that they can really truly focus on the patient experience and the outcomes, and we can focus on the, financial side of things.
Right. We know that demand for health and wellness care is rising. We have an aging population. There is a need for that. So talk about that in-house financing. You brought that up you just a moment ago brought up in-house financing. So talk about how our providers can optimize that for spreading out cost over time, how it can make their businesses more efficient, more profitable from a financial standpoint.
Absolutely. And I can't stress enough how important it is to have that conversation early in the patient journey as opposed to on the end of the patient journey, because it takes the burden and the ease off the patient to make those decisions and convert more patients to get the care that they need right away. But when you think about the some of the trends that you've seen in some of the benchmarking, there's an additional burden that's placed on the health systems and practices when you have to collect monies, and the additional expense that you incur by trying, working with third parties and trying to collect on receivables based on what you're allowing patients to finance through the practice. That can become an additional burden with all the challenges that the health systems and the practices have as far as staffing, just burnout and things like that. Financing can certainly enable that, or it certainly help to eliminate some of those strains, because we're providing an easier way for patients to be able to get the care that they need. And those additional overhead costs related to, having the staff, having to pay for a third-party vendor to collect, those monies can be incorporated into potentially adding more staff so that you can see more patients and provide more care. So we try to think about this from a big picture perspective. It's not just about, financing. We want to make sure that our practices have the tools that they need to be able to care for the patients that are coming in to see them on a day-to-day basis.
Okay. I'm trying to get my head around it. I've obviously financed a few cars over time, so yeah. I've been on that side of it. But when we're talking about these providers, what are some of the solutions they're looking for, and what are some of the ones that CareCredit's providing for them to make their lives easier in the fact of running their business?
Absolutely. So one of the things that we have really focused on and we're investing in is working with third-party ISVs, and those are companies. You think about the Epics of the world or Salute Bros. We try to partner with these companies because they provide a platform that helps facilitate a lot of the transactional services for the patients as well as the providers. They have provider-facing websites. They have patient-facing portals where the patient can go in and pay their bills. One of the things that we look to do is we try to integrate our solution into those platforms. So when an administrator is working with a patient and they are focused on, how are we going to pay for this bill now? We are integrated into those platforms so that the patient can use their CareCredit card to make those transactions seamlessly and frictionlessly through those platforms. So that's just one of the many ways that we try to help support the providers by plugging into platforms that they're already using and just creating additional utility by adding CareCredit to that menu of options for patients to be able to pay.
Okay. Now, you've talked about third-party financing options a couple of times already. So let's go down that road a little bit. What are some of the benefits that providers should be aware of? What are some of the options that they have when they utilize that third-party financing?
Absolutely. I think the biggest thing is convenience and conversion. And convenience meaning that a very simple, easy way for patients to be able to pay for care that they need, whether it's through they can do it from their phone, they can do it from their keyboard. Again, working with ISVs, if you're doing if we're plugged in with a company that does appointment setting, we can actually facilitate payment before. So it takes some of that administrative burden off when someone has to come into the office and they have to collect payment prior to services being rendered. So the ease of use is in the convenience of that allows the administrators and the doctors and nurse practitioners to be able to focus on the patient. It also, and that also helps with savings. We can help the practices save money because anytime you have a patient who decides that they're not going to get the care because they're worried about cost, that's revenue. That's revenue that won't be collected from the practice. And then on the back end, you think about the collection services and, those balances start to roll and potentially become bad debt. That's a financial burden for practices. So the earlier you can work with patients and collect that money, the more savings you're going to get. That's going to help your P&L. So we try to help educate practices and make sure that things are frictionless and really try to adopt CareCredit earlier in the process so that they can benefit on the back end by, one, patients having good outcomes, patients being satisfied, and then being able to pay directly to CareCredit as opposed to the doctors trying to collect on the fees.
Okay. Couple of questions in before we sign off. I'd really like to talk about something we've talked about previously, and that's about having those transparent financial conversations with patients. Mm-hmm. When the providers are in that situation, is there coaching? Is there any tools, scripts, anything that CareCredit can provide them with so they can have more comfortable, transparent conversations? Because those can be a little bit tricky to navigate. So where can y'all come in, provide some coaching, some guidance to have those transparent financial conversations?
Absolutely. First and foremost, we have a lot of educational materials out on our website, CareCredit.com, www.carecredit.com. And you can find a host of different information on having the financial conversation, understanding payment options. One of our value props is deferred interest payment options. So you use the analogy of, you bought a car or you bought a piece of furniture. Deferred interest financing simply allows patients to pay over time. And if they're on a 12-month, what we call deferred interest, if they pay that full balance in full at the end of the 12 months, the interest that has been accruing will be waived. So you've essentially financed a product and not have to pay any interest on that. So that's a savings to that patient. So it's important to make sure that our doctors and practices understand how to have that conversation, how to explain how deferred interest works, when payments start. And a lot of these tools are not only at the fingertips of the practice, but they're at the fingertips of the patient so that they can see that and understand the different options that they have when they're deciding on getting care that they need. So it's very important that we continually try to share that information and we communicate out to our practices on the different tools that they have right at their fingertip. There are tools that we push out that explain promotional financing. We explain some of the research that we have that really help understand how patients are viewing some of the options that they have, or in some cases, some of the misconceptions. Trying to explain to patients there's a difference in cost between in-network and out-of-network, understanding your deductibles as a result of where you choose to get the care that you need. And then we can talk about, okay, there's CareCredit and there's options that you can use to get that care through this financing tool.
What have we not talked about here that's on top of mind for you? As we've talked about it, you are a financial road warrior out there. You hit a lot of the conferences and things. You're hearing from those providers directly. Mm-hmm. What would you like to share with us to our listeners before we sign off today?
Yeah, I think that the main thing I would say is, again, I think that our capabilities, our financial products and suite of products are very valid and valuable options that should be incorporated into those financial discussions. We strive to continually make these products better, more efficient, and allow practices to focus on the care that they need to get the patient and allow us to be the experts in, lending money and collecting money. But we've been doing this for 35 years in this space, starting in the dental space, and we've expanded into a variety of other industries. But the reality is, we're in an interesting time right now, and I think that everyone's feeling the strain in some form or fashion when it comes to cost, when it comes to what do some of the things that are happening macroeconomically mean to them. We may not feel it now, we may feel it tomorrow, and it's going to affect the decisions that we make, particularly in the health and wellness space, on whether we're going to get care. We want to make sure that CareCredit is in the forefront of those conversations as well, because we don't want patients to devalue the care that they want to get or delay or postpone because they're concerned about cost. And that's where we come in. So we want to make sure that we're providing financial options that are going to allow patients to make good decisions without overburdening them financially, but most importantly, taking care of their health.
Okay. Well, Claude Royster, thank you for joining us again on the MGMA podcast.
Thank you for having me. Appreciate it.
You got it. So we've been talking to Claude Royster. He's Vice President and General Manager of Health and Wellness at CareCredit and Synchrony. And we're going to provide direct links to some of their research so you can click right to it, learn more about what they're doing. Until then, I want to thank all of you for being MGMA podcast listeners.